Good morning, USRNs. Today we will talk about fundamentals of nursing. Kasama sa discussion natin today is going to be fluid compartments, fluids in the body, fluid complication, IV therapy, safety and control. Isama na rin natin si Donnie and Dolphin pagdating sa gloves or PPEs or gown. So kapag merong hindi na-discuss dito, I will create another video, part 2 for fundamentals of nursing.
Alright, the first discussion would be fluid compartments. Sino-sino ba yung fluid compartments ng katawan natin? We have 3. Intracellular, which is inside the cells. Intravascular, which is inside the veins. Extracellular, which is outside the cells. Again, intracellular, intravascular, and extracellular. Unahin natin sa extracellular. These are the components of or compartment of organs. Understand about subcompartments. Ito yung interstitial spaces. Kasama dyan si heart. Ang spaces sa heart, we have pericardial space and pericardial fluid. Pericardial fluid normal value is 30 ml or 30 cc. A condition wherein there is a decrease of fluid in the heart is called pericarditis. Signs and symptoms of pericarditis is pleural friction rub. Pericarditis, the cause of it is infection. The outcome of the infection is obviously fever and sore throat. Ang pangalawang components kay heart is si cardiac tamponade. Si cardiac tamponade, this is a priority. It presents symptoms of Beck's triad. Ang tatlong symptoms ng Beck's triad is muffled heart tones, hypotension, and jugular vein distension. Again, Beck's triad under cardiac tamponade, which is priority. Signs and symptoms would be muffled heart tones, hypotension, and jugular vein distension. After kay heart, nandiyan naman po si lungs. Ang space ni lungs is pleural space. Ang fluid ni lungs is pleural fluid. Ang normal rate ng pleural fluid is 10 to 20 ml per or cc. Again, 10 to 20 ml per cc. So parang inad mo lang yung 10 and 20 para makuha yung pericardial fluid normal value ni heart. Kasi si lungs 10 to 20 ml per cc. Again, lungs is 10 to 20 ml or cc. Tapos si heart is 30 ml or cc. So, kung merong problema sa fluid sa lungs, ang term po dyan is pleurisy. Ang symptoms naman ng pleurisy is knife stabbing pain. Ang symptoms po ng pleurisy is knife stabbing pain. So parang sinaksak yung lungs mo. Meanwhile, if there is an increase of fluid, it's pleural effusion. Effusion increase. Pleural effusion. Yung symptoms naman dyan is crackles. So kapag may narinig kang crackles during auscultation, ang ibig sabihin yan, merong increase of pleural fluid in the lungs. Pero kapag knife stabbing pain naman, syempre kulang sa fluid, so magkakaroon ng knife stabbing pain. So after kay heart and lungs, si brain naman, ang space sa brain is subarachnoid space. Ang fluid naman sa brain ay cerebrospinal space. Cerebrospinal fluid. Again, kay brain, ang space niya is subarachnoid. Ang fluid niya is cerebrospinal fluid. If there is an increase of intracranial pressure, you need to watch out for that kasi that's the effect of cerebrospinal fluid decrease. So kapag merong decrease kay cerebrospinal fluid, i-increase yung intracranial pressure ni brain. So you need to watch out for that. This is common for patient among children, which is hydrocephalus, there is an increase in cerebrospinal fluid. Same symptoms of increased ICP if there is an increase of cerebrospinal fluid. So ICP and cerebrospinal fluid is just equivalent. Both increase in intracranial pressure and also increase in cerebrospinal fluid. So gaano ba kahalaga si fluids in our body? The function of fluids, this plays an important role in the body. Rehydration, facilitation, or it facilitates cellular movement, and the source of water in the cells. Meron tayong tatlong category: isotonic, hypotonic, and hypertonic fluids that we need to administer depending on the kind of condition that the patient have. For isotonic, this is the very first choice wherein it gives exact amount of fluid. This is commonly used during emergency, during dehydration, during shock, during burn. Ang example ni isotonic solution or fluid, those are the fluid that begins with letter P. Nandiyan yung PNSS, no? Yun yung common kinds of isotonic fluid. Si hypotonic naman, this is going to be the second choice if isotonic is not available. Si hypotonic naman, it will give excess amount of fluid to cell. So kung si isotonic ay exact, si hypotonic naman is excess amount of fluid to the cell. That is why it will make the cell swells. Solutions for hypotonic is also for dehydration and burns. Example ng hypotonic, those are fluid that is below 0.9%. Example 0.33%, 0.45%, 0.18%, 0.25% sodium chloride. The third one is hypertonic. The cell shrinks due to pulling out of excess water from the cells done by glucose. So, ang nangyayari sa katawan natin, pinupull out ni glucose ang excess water. That is why it will lead to cell shrinkage. Si hypertonic, this contains glucose in the form of dextrose. So, di ba kailangan natin si glucose para ilabas lahat ng excess water from our cell para mag-shrink si cell? Always remember, dextrose contains glucose. D equals glucose. D equals diuretic effect. Meron siyang diuretic effect. Example ng hypertonic solution are solutions with the letter D. D5LR, and this is higher than 0.9%, NaCl like 3%, 5%, 20%, albumin, and many more. Because of D5 water tonicity inside the cell, which is hypotonic, ang D5 water kasi, tonicity of it is inside the cell. Inside the cell is hypotonic, right? Outside the cell naman, yung tonicity niyan is hypertonic. Hypertonic. This is for patient having congestion and patient having edema. So kapag si patient meron siyang congestion and edema, ang tonicity ng cell niya is hypertonic. So we need to administer hypertonic solution. No, hindi isotonic, hindi hypotonic, but hypertonic solution. Okay, ngayong nalaman na natin yung importance ng fluid sa katawan natin at kung ano yung mga i-administer kapag kulang yung fluids. Again, just a recap, nandyan si isotonic solution, which is the first tonic solution for emergency cases. dehydration, shock, and burn. Nandyan din po si hypotonic solution. Also for dehydration and burns, which will give out excess amount of fluid to the cells and make the cells swell. Nandyan din po si hypertonic. We need to shrink the cell and we need to administer dextrose water to the patient because dextrose contains glucose and glucose is the one that pulls out any excess water outside or any excess water on the cell, so it will create physiology of cell shrinkage. So meron siyang diuretic effect. This is for patient having congestion and edema. So ngayon pag-uusapan naman natin si fluid complication. So fluid volume excess, kapag sobrang fluid na sa katawan, that's what we call fluid volume excess. Diseases under fluid volume excess is ESRD, that's end-stage renal disease. That includes chronic kidney disease and AGN, acute glomerular nephritis. Nandyan din po si chronic heart failure. Nandyan din po si endocrine problems. Endocrine problems like SIAD, Cushing, cerebral edema, and that's it. SIAD, Cushing, and cerebral edema. So si Cushing, ito yung kabaliktaran ni Addison's disease. Si Cushing meron siyang fluid volume excess. Okay. It will also be included here si hypovolemic shock. Si hypovolemic shock under endocrine problem. In order for you not to forget about hypovolemic shock, you need to raise your index and your middle finger. That will denote tachycardia and tachypnea. Yung ring finger mo naman and your pinky finger, that's gonna be hypotension and hypothermia. Tapos yung distance between the two is going to be narrowed pulse pressure. Okay? So, signs and symptoms of fluid volume excess. Syempre, madami kang fluid sa katawan. You will see the patient as having increase in weight. And si edema, meron ding signs of edema. Meron ding crackles, 'di ba? Kapag excess of fluid, we will hear crackles and difficulty breathing. Crackles and difficulty breathing. Kung matatandaan nyo, under lungs, kapag si pleural effusion is mangyayari. Pleural effusion, again, there is an increase of fluid or pleural fluid in the lungs. It will produce crackle sounds. So, signs and symptoms of fluid volume excess is crackles and difficulty in breathing. And of course, meron ding pleural effusion. Yun na nga, pleural effusion that will produce crackling sounds. Si muffled heart tones, kasama din po dyan. And among pediatrics, merong bulging of fontanelle and periorbital edema. For the lab results, there is an increase of cerebrovascular CVP. Lab results increase in CVP. Decrease hematocrit. The normal hematocrit level is 36 to 50. If there is a decrease in hematocrit, that's what we call hemodilution. Decrease begins with letter D. Hemodilution, there is a letter D in the middle, so always remember that. Decrease hematocrit or less than 36 from the normal value of 36 to 50, it's called hemodilution. For fluid volume excess, we can give hypertonic solution. Okay. Now, the fluid volume deficit on the other hand, eto naman, there is a deficit of the fluid volume in our body. We need to assess for diseases like diabetes insipidus, ihi ka ng ihi, or daming ihi, diarrhea, dehydration, burns. Tapos dito naman si deficit, Addison's disease, which is the opposite of Cushing, hyperemesis gravidarum, gravidarum magsuka, gravi magsuka, pyloric stenosis, and shock. Signs and symptoms, kabaliktaran sa fluid volume excess, dito merong weight loss, flat neck vein, sunken eyeballs and fontanelle, xerostomia or dry mouth, parang si Rostom Padilla, dry ang mouth ni Rostom Padilla due to fluid volume deficit, xerostomia, poor skin turgor of course. In abnormal lab result, there is a decrease of CVP, increase in hematocrit, increase hematocrit, hemoconcentration, increase hematocrit is hemoconcentration. BUN will also increase and the creatinine will also increase. Again, the normal creatinine value is 0.6 to 1.2 and the normal blood urea nitrogen value is 10 to 20 mmHg. Pero si BUN creatinine ratio is 6 to 25. So, tandaan, creatinine normal value is 0.6 to 1.2, BUN normal value is 10 to 20, pero blood urea nitrogen and creatinine ratio is 6 to 25. Medication or fluid for volume deficit is si isotonic and hypotonic. Again, fluid volume excess, excess of fluid in the cells na kailangan ilabas ni dextrose, hypertonic yung ibibigay. Whereas if fluid volume deficit, kulang sa fluid sa cells, we can give isotonic and hypotonic. Okay, now let's go to IV therapy complication. IV therapy complication. It may cause inflammation of the brain that we call phlebitis. Phlebitis. The skin is warm to touch. No? And there will be infiltration. The skin is cold to touch. So kapag phlebitis, warm to touch. Kaya phlebitis, parang flame, warm to touch. Infiltration on the other hand, you will feel cool skin. Infiltration, skin is cool to feel. It will also lead to extravasation, which results from second-degree burn that causes vesicant, or the adverse cause is vesicant drugs. By the way, second-degree burn is the most painful burn due to blister formation. Example of vesicant drugs, we have potassium chloride or KCl, chemotherapeutic drugs, vancomycin, and all of the other drugs that contain scenes. You need to manage exacerbation by the following. This is an order. You need to stop the infusion, you need to elevate the affected arms, and you need to notify the physician. So if extravasation will happen, you need to stop the infusion, you need to elevate the affected arms, and you need to notify the physician. Now we will go to safety and control. We will talk about specific precautions. So we have airborne precaution, droplet precaution, and contact precaution. We also have enteric precaution. Let's talk about airborne precaution first. There are a few diseases under airborne precaution. Airborne precaution, the agents are being mixed through air particles. Kaya siya naka-airborne precaution. Diseases like Koch's disease or tuberculosis, SARS, varicella or chickenpox, herpes zoster or shingles, robeola or measles. What are the PPEs in airborne precaution? We have N95 mask and HEPA mask. The room should be private with negative air pressure. You need to put surgical masks to the patient every time the patient is being transported or is walking outside of the room. The second precaution is the droplet precaution. The droplet precaution, you need to note diseases that has dropletism. Diphtheria, rubella, oral pharyngitis, pertussis or pneumonia, legionnaires na nakukuha sa aircon or air conditioner, erythema infectiosum, tonsillitis, influenza, scarlet fever, mumps, and meningitis. The PPE for droplet infection droplet precaution is surgical mask, and we need to stay like 3 to 6 feet social distancing from the patient. The room is private. So surgical mask for droplet precaution, maintain social distancing of 3 to 6 feet, and the patient must be in a private room. Si contact precautions naman, these are the diseases that has mnemonics of CRIB MVH. CRIB MVH. We have the C. difficile or Clostridium difficile, rotavirus, impetigo, bronchiolitis or bronchiolitis or RSV virus, MRSA or VRSA, and MRSA, we also have VRSA or vancomycin resistance, hepatitis B, C, D, G. B, C, D, G. PPE for contact precaution is GG. Gloves and gown. Contact GG. Tips to remember on vancomycin. Vancomycin can cause hypotension, facial flashing, kidney damage, and extravasation. Again, vancomycin may cause hypotension, facial flushing, kidney damage, and vanco or extravasation. On administration, give vancomycin slowly in 1 hour. Remember that hand washing is applicable to all precautions. Side notes, rubella means German measles. The last precaution would be enteric. Enteric naman, these are for hepatitis A and E. This has something to do with GI. Or let's say, kapag yung cause niya is unsanitized food, it will lead to salmonella. Kapag unsanitized water naman, it will lead to Shigella. Shigella, siya yung nagtitinda ng buko pandan. Si unsanitized food is salmonella. PPE, hand washing plus contact. Hand washing plus contact. Hand washing plus contact. Contact. GG. Gloves and gown. Alright, the last topic would be donning and doffing. Donning and doffing, ito yung insertion of gloves and removal of gloves or PPEs. So insertion or application of PPEs and removal of PPEs. Merong magic dito. Alam niyo yung kantang Hep Hep Hooray? Hep Hep Hooray. So ibig sabihin nun, Hep Hep Hooray. Hep Hep Hooray. Hep hep hooray. Hep hep hooray. So hawakan nyo lang si gown, mask, goggles, and gloves. Itaas si gloves. So gown, mask, goggles, and gloves. Gown, mask, goggles, gloves. Gown, mask, goggles, and gloves. Touch your gown, touch your mask, touch your goggle, and itaas ang kamay. Hooray. Gown, mask, goggles, and gloves. Hep hep hooray. Hep hep hooray. Si Dolphin naman, ang pagkakasunod-sunod nito is meron tayong initials na Heb-N. Dolphin Heb-N, 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 Heb-N. Ibig sabihin ni Heb-N ay hands, which is for gloves, PPE, eyes, which is goggles, PPE, the body, which is for the gown, and the nose for the for the mask. So Heb-N, 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 Dolphin, Heb-N, 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 Dolphin, Heb-N, 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 gloves, goggles, gown, mask. This is for hands, eyes, body, nose. Heb-N, 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 Heb-N. Ayun lang. Thank you, USRNs.